honorable members and the MEC and your team, we want to welcome you to the portfolio meeting, where we will discuss about two substantive reports, as well as the feedback on the resolutions, and extremely, after we've dealt substantive food, some extreme brief of the work we have done as Senderitas Honorable MEC. But before we start, I think I must, on behalf of the portfolio, offer our sincerest apology for keeping the department waiting far too long. We hope that you are accepting our apology, MEC. We had a problem when we were to start. About 3 of our members were requested to go to the meeting with the speaker and in what they call internal arrangement. And of course, I learned that, hey, we are not equal, because when they come here, they were coming for help. And the deputy speaker just look at them and say, you must be here. And they run, they go to that meeting. Although this was in a lighter note, but that's what happened earlier this morning. So that's the reason that I could not say anything further before I ask for an apology. And the MEC, she's looking at me with sympathy, but I'm happy that she says she accepts the apology. But I want to hear her talking when we will be giving her that opportunity to say we have accepted your apology. May I remind you that we are live, and we are together with our people who may be watching us on our live stream. With that, I think we can now deal with the agenda item number 2, and check with you, Maseti, if you have any apology from our side.
Thanks, Honorable Chair.
Sorry that you were never a shop steward. Let's speak a bit.
Yeah. Okay. Thanks, Honorable Chair. Good morning, members and colleagues. We have apology from Honorable Nkonyana on party political commitments. Honorable Mate, same party political commitments. Honorable Lebeya is attending the National Prayer for Transport as the chairperson of the Transport Committee. Thanks.
Thank you very much. For sure, the MEC have full complement, I can see. Say so, just say we have full complement.
Thanks, Honorable Chairperson, and greetings to yourself and the committee, AG, and all members who are present here. We don't have the DG Health for District Services. She's on annual leave, and also DDG Corporate Services, he's attending to other departmental commitments. But we've got everyone who will be able to respond to the questions. Thank you.
Okay, thank you very much. I've observed that is a tradition that even if you know each other, you continue on introducing yourself. For sure, Honorable Mtak, must we do it for the last time in the health? Okay, thank you very much. Of course, in our midst, we also have the representative of the Auditor General in this meeting. I'm Tshweni Malawana. Let's quickly do that. The chair of the committee. It's not all.
Good morning to you, Lindy Wilson, member of the Portfolio of Health in the legislature.
Good morning, Chair and honorable members, MEC and your team. My name is Peter Ngubeni, a member of the committee.
Good morning, Honorable Chair, honorable members, honorable MEC and team. My name is Andre Moss and I'm also a member of this committee.
Afternoon, my name is Thabo Mabotja, member of the committee.
Ndomase Arendebole Jacob, member of the committee.
Nhlikani Falazamdaka, member of the committee, Nakens.
They have it outside. Yeah. Just start.
Good afternoon, Mawalane Chidzibe Communication Services.
Good afternoon, Mudiba Renelo, IT support.
Good afternoon, Susan Malungana, ANC Party Caucus.
Good morning, Dieketseng Masheru, MEC Health.
Good morning, Honorable Chair, honorable members, honorable MSc. I'm Dodeni Ndwamato, I'm the HOD Health.
Good morning, I'm Mr. Mudau, CFO Health.
Good morning, I'm Mikateko Tlakula. I'm the acting DDG for corporate services.
Good afternoon, my name is Alpeli Ravuruvuru, Chief Director, Strategy and Systems.
Good afternoon, my name is Panelan Ramawa, Chief Director, Infrastructure.
Afternoon, Movango Nchengezeni, Acting Director, Monitoring and Evaluation.
Winteratlo, Head of Office, MEC Support.
Morning, colleagues, Mpetedi Matlatle, Parliamentary Officer.
Good afternoon, Dr. Mshadu, Senior Clinical Manager, Officer MEC.
Good afternoon, Desmond Lope, MEC Support.
Good afternoon, Marupingwana from the Auditor General.
Good afternoon, Unia Pilusa, AGSA.
Good afternoon, Honorable Chair, Honorable members, Honorable MEC and team. Rikus Roots, I'm the researcher for the Freedom Front Plus. Thank you.
Good afternoon, Honorable Chair, Honorable members, Honorable MEC and the team. My name is Klaas Mhlong from Auditor General.
Good afternoon, Lerato Masiti, Committee Coordinator.
Afternoon, Isaac Nkuna from the Research Division.
Good afternoon, Pauline Sokeza, Research Division.
Thank you very much, honorable members and all that you have introduced. The colleagues that are in my right and left, they are saying to me, here's the new HOD, say something about it. I said, no, it's the MEC that is going to say that first before we congratulate. MEC, we are now on item number 3 with his intention is to deal with the previous committee resolution. And without much ado, I'm going to give you, your team, an opportunity to do a brief feedback about those resolutions. Thank you very much.
Thanks very much, Honorable Chair. And yes, indeed, let me do the diligence of saying it's an honor for me to say today I'm not with the acting HOD. Finally, we have appointed an HOD in the Department of Health, and we are here with her, Dr. Ndoteni Ndwamato, our HOD. So I say the first question for the portfolio committee, which has been the standing question, it's already been resolved. We have an HOD on health. So we will just hand over to the HOD for the responses. Thank you.
Congratulations and good luck.
Thank you, Honorable Chair, Honorable Members, Honorable MEC and colleagues. Thank you for the congratulations. The pressure now is real.
No more Hollywood.
So in terms of the resolutions, tracking tool that is provided to us after meeting as well as the progress report, I think I will put more emphasis on the ones that are not in the reports. The first one being that as a department, we have been instructed to convene a meeting with relevant stakeholders and invite the committee to discuss the teenage pregnancy in the province. So this matter, as a department so far, we have written to the social development because they are the leader in the social cluster to assist us in convening the workshop. And they've just concluded the teenage pregnancy implementation strategy, which all the departments that are dealing with this matter has now given input, and that strategy is just about to be approved. And also, so when we wrote to them, they were also having a new HOD coming into their space. So we are still waiting for the date. We'll do follow up to ensure that this matter is attended to as we continue to still see, although the numbers have reduced because of the systems that we have put in place in the past, especially that when a teenage delivers in our facilities have got an SOP to ensure that that matter is reported to SAPS. So we have seen the numbers reducing, but the workshop is still going to occur. And then the second one is the issue of us having not able to have enough coverage in terms of the vaccinations. And we've just concluded our strategic plan. The information we've already provided there, those are the areas that we have done that, and we've just concluded our strategic plan now where we're coming up with strategies, because we have noted that in the past we have always said we'll do catch-up campaigns, and we noted that the catch-up campaigns are just once off, and we continue to have these areas where we are not reaching adequate children in terms of the immunization. So that is the one that is there. And then the third one, the department having an issue with to explain the plans to address challenges such as shortage of personnel in EMS, issues of as well as infrastructure around EMS, and then also looking at the vehicles that are supposed to be there. So the department we are currently now, there will be an advert before the end of next week, if not today, that is addressing some of these challenges, including EMS issues. For the first time, all our EMS stations will be having managers. So meaning once you have a manager there, then they are able to look at all these other issues that have been identified, such as infrastructure issues, shortages, rostering. And I can also report that actually in terms of rostering, that has also improved. We used to have days where we would not have coverage. So that has also improved from where we were because of the improvement. We've been having serial meetings with EMS to look at this issue to see how we can improve. And then we are also purchasing additional vehicles in this in this year, which will be also aiding so that we improve on this situation, and that is under EMS. The infrastructure, in terms of the EMS, we have also, there are some EMS that currently we are busy improving on them. The infrastructure is in place. We have a plan to ensure that all our EMS are compliant, because they are also supposed to be licensed for them to be operational. So we are busy now systematically putting that in place. The CAT system that we have put in place already, that is assisting us as a communication center. One of the issues that we picked up was that a number of calls that are coming through the call center being dropped because of the number of personnel that were in the call center. So what we have done, I think we have also taken the advice from the committee. We are going to be in the next week as well, advertise, in a way, learnership in EMS, those people who have qualified as EMS to come in to operate in our call center, so that will also assist in reducing the performance of our CAT system, and that is already in place. The issue of the relationship between us and the state attorney, and the resolution that we have taken to look for panel of attorneys, I think that is at advanced stage. In terms of that, we have a probity committee that looks into our contracting system, so it has already passed through that, and we are hoping that very soon we'll be having that in place to assist us with dealing with our legal and medical legal issues. We continue to collaborate with the SIU in this space, wherein not only the SIU coming into us and requesting, but also us going into the SIU and reporting cases that we have picked up that this is a possible fraud. And then the EMS college, we are still on track. We just had a workshop with the committee in the past, in this month, beginning of this month, and the team is busy now ensuring that they put those systems in place. We have also taken the advice that we received to say, especially, no, this one is for the nursing college. I almost reported the matter on the nursing college, where we received an advice to say we need to look at abandoned school buildings, and we have also taken that advice. We have returned to Public Works as well as Department of Education, so that they can assist us in identifying these areas which we can actually renovate and ensure that we do that. The next one is it was on maintenance. We have provided the report with a list of maintenance projects in the province that we are currently busy with, including the value on all those maintenance items. So that was the one we have provided the list there. I think that is the last one. The rest, I think, are the reports in relation to those matters. Thank you.
Thank you very much, honorable members. That's the report. I've got a view that if it's not going to trouble you, that they report on other report. If it's not going to, you are not going to have a problem of segregation of matters. Agreed? Okay. We can go to the substantive report. Honorable Vo.
Greetings to everyone in the house. The newly appointed HOD touched on the issue of the forthcoming advert, but did not specify, unless if I missed it, are you, as per previous discussions, are you recruiting new people to join the system who will then be undertaken through various levels of EMS in terms of resolving the shortage, or it is just going to be new entrants? Remember, I'm raising this based on the fact that most of your personnel in the province do not qualify to satisfy the requirements of advanced life support and so forth, which creates problems to the healthcare system in the province. And the last issue, Chair, is with regard to, we appreciate the teenage pregnancy approach, and we note that indeed the department is listening when inputs are made. Just make sure that you don't lose track of following up on Department of Education and Public Works, in particular on abandoned schools. They can come handy and save the department lots of costs. But just a point that the teenage pregnancy intervention, I think whatever engagement you have must also come up with, even if it's a booklet, which can be given to communities and young people at the level of schools. But that booklet must be detailed in a way that it has inputs of all stakeholders, including SAPS, which includes how to report in case you encounter this problem at home or anywhere, psychologists, the Departments of Health and Social Development, and all stakeholders, so that those who did not attend the workshop or whatever engagement can still have this information available to them for free, and they can use it in their private space. Thanks, Chair.
Thank you very much. I merely say to you, why don't you keep the input for the whole discussion? For sure, we'll not have a problem if they noted what you said, and they come back and give feedback when we will be discussing. Because I also realize that with regard to the resolution taking, there are one or two matters that the HOD have left. I'll just mention them by that time to give them opportunity if they have feedback about them. Thank you for that. And now we'll invite the department again, the MEC, to lead us with regard to test for first quarter performance for 2025 and 2026.
Thanks, Chair. We'll hand over to HOD for the reports.
Thank you. Dr. Mubango, if you can take us through.
Afternoon, Chair, members of the committee, MEC, and the executive of the department. Can we use the slides, the PowerPoint?
The light, maybe they must switch off the light this side.
No, I was requesting that we use the PowerPoint slides that we've submitted.
These men here are dangerous. The only person that I heard that you want this slide. And you are comfortable with the light? Honorable members? Okay. responsible MEC for the absence of Honorable Mate. Because one day he was asking about everyone's acting. What does the law say? He's not here to do this. And I suspect that he was irritated that day to accept a work somewhere and ask apology because of the Hollywood that was here the last day. They are still struggling with technology. The issue, HOD, that the issue we have left, one of it is related to the Office of AG's Finding Audit Action Plan, implementation progress. The other one we mentioned, it was about filling of critical posts. The other one is about procurement of health information system, and this was triggered by the department's intention to withdraw from CETA. If that became possible, the issue of nursing you have dealt with it. The other one was related to activities by the department regarding the national health insurance. What you are busy with, because we have, you know, that day we have told you that our attention is that we are told that the people who have those activities, they have potential to attract funding to you. The other one was related to, which for sure you would not recognize, it's about the overall healthiness in a number of facilities, which we have seen as a challenge as we go about visiting your health facilities. And for sure you have dealt with the significant uncertainties that is caused by medical negligence. And how did this came? You do a hint with regard to the use of panel of private attorneys, because there was a problem of the state attorneys that are not, well, for a lack of a better way, they are not servicing the department properly. This one I'm mentioning, even if I have information just to close it, on what is it, was it possible or is it probable that can happen? Yeah, earlier when we were with the AG, they also found that there are other people who don't bring summons to you. They take them straight to the state attorney. We didn't tell the AG that we have a problem with state attorney. We just received that information with regard to the problem of medical liquor. But here I'm saying the context of the previous resolution that you be aware of, so that you complete that part. Yeah. Okay. Are you ready?
Yes.
Oh, thank you very much. You are on the floor.
Okay, thank you, Chairperson. So I will be taking you through the first quarter performance report of the department. So the first slide there is just to show the overall departmental performance. to say that in the first quarter of all our targets, we have managed to achieve 50%. So, and the breakdown as reflected there is to say that program 1 of their targets that were reported, they managed to achieve 33.3%, meaning that they achieved, out of 3, they achieved 1, they didn't achieve 2. Program 2, they have 26, they achieved 11, they did not achieve 12. So the overall there was 47.8%. Program 3, they achieved all their targets. Program 4, 5, 6, their targets are actually reported at the end of the fourth quarter. But for the purpose of this report, we will give progress in terms of their own targets. Program 7, out of 3, they managed to achieve 2 of their targets for the quarter under review, and that translated to 66.6%. So now we'll go to the details of the performance. We'll start with program 1. Program 1, in terms of percentage compliance to payment of suppliers within 30 days, the program couldn't achieve 100%. They achieved 99.87%. The reason being that they are still having challenges with BAS systems, but overall they are still working on it. They also didn't manage to achieve revenue collections targets. The target for the quarter was 56.1 million. They managed to achieve 54.5 million. And the reason for that is still challenges around the road accident fund. In terms of the expenditure for program 1, they are currently at 27.9% of the overall budget, which is not so far away from the norm. Program 2, in terms of primary healthcare services, patient experience of care survey rate, currently during the quarter, they were still preparing for the survey. As you are aware that the survey that gives us the outcome for PEC is usually conducted in the second quarter. So by that time we were still preparing so that all systems were ready for conducting the survey. For PXC mental disorders treatment, the program could not achieve the target of 0.1%. We achieved 0.01. So we still have challenges around how the data element is interpreted in our facilities. And we're working on that. In terms of sub-program district hospitals, patient experience of care survey rate is the same issue here. We're still preparing for the survey. Sub-program HAST. So here in terms of HIV infections, we performed well. For the 2 age categories, 5 to 14 as well as 15 to 24. So we performed well here. So in terms of ensuring that our patients on HIV medicines remain on treatment, we didn't do well in terms of adult. We were at 88.1% when the target is 95. So the challenge there is non-adherence to treatment by our patients. In terms of child remaining care, we performed well at 97%, but overall in terms of viral load suppressions, both for adult and children, we are not doing well, but overall we do have interventions that are currently yielding some positive results. So in terms of number of TB patients on treatment, those who are above 5 years, our target was to at least manage to treat 2,313. We did not achieve the target. We managed to put around 1,968 patients on treatment. The reason being that poor implementation of the targeted universal TB testing in facilities. But otherwise, we are having interventions that will improve that performance. In terms of treatment of TB patients who are under 5 years, we are currently doing well, as well as TB client treatment success. We are currently at 81% and the target is 81. In terms of MDR TB treatment, the patients that we have managed to put on treatment for the quarter, we managed to put around 33 when the target is 63. So we didn't do well. The same reason applies, that of not implementing the targeted universal TB testing well. In terms of MDR treatment success rate, we are doing well at 81.1%. We are also doing well in terms of couple year protection and as well as a number of deliveries in those who are 10 to 14 years. Antenatal first visit before 20 weeks rate, we are not doing well. We are currently sitting at 67.1% when the target is 68. The reason there, of course, being late recognition of pregnancy among women. Mother postnatal visit within 6 days rate, we are currently sitting at 93.6% when the target is 97. So we are also not doing well there, but we do have interventions that we have put so that we can improve. We are also actually doing well in terms of children who are dying of diarrhea, pneumonia, as well as severe malnutrition. So you will realize that in the last quarter we didn't do well in this indicator, but currently we are doing well. As well as under immunization, under 1 year coverage, we are also doing well at 76.6%. MR second dose 1 year coverage, we are currently sitting at 84.1%, which is actually below the target of 85. And the reason for that is simply because of children who are actually dropping out between the first and second dose. So we are also working on that so that we can improve. In terms of infant first PCR test positive at birth, we are doing well. Cervical cancer screening coverage, we are not doing well. We achieved 19.7% and the target was 28. So the reason there, of course, was the poor marketing of cervical cancer screening services in our facilities. And we're also doing well in terms of malaria case fatality. We were at 0.4%. So in terms of expenditure overall, the program expenditure was at 21.9% of the overall budget. Of course, it was a little bit below the norm. So the main reason that affected that expenditure was actually the machinery and equipment, wherein we were still waiting for orders to be released, as well as in goods and services. Program 3, which is emergency medical services, we continue to do well in this program, mostly because of the extra ambulances as well as the CAT system that has been implemented. In terms of overall expenditure in Program 3, we were sitting at 26.9% of the overall budget of the program, which is surely around the norm. Program 4, provincial hospital services, as I said, the patient experience of care survey rate is not yet to be reported. It will be reported, of course, in the second quarter, but overall, we were still doing the logistics so that we are ready to conduct the survey. The same applies to specialized hospitals. In terms of expenditure for the program was sitting at 21.8% of the overall budget. So the same applies to Program 5, since the only indicator there is patient experience of care survey rate. So in terms of expenditure for program 5, they were sitting at 22.7% of the overall budget. So the areas that affected that expenditure is machinery and equipment, as well as goods and services. Program 6, health sciences and training. Here, just to give progress in terms of the intake of the new students, we were actually doing the processes that will eventually lead to the intake next year of 200 students. But overall, the program, in terms of expenditure, they were sitting at 22.1% of the overall expenditure. And the areas that affected that was actually machinery and equipment, as well as COE. Program 7, which is healthcare support services, in terms of availability of essential medicines, we performed well in terms of availability at the depot as well as hospitals. We were above 80%. The only area where we didn't do well is availability in the PHC facilities, where we were at 78%, when the target was 82%. And the main issue there was the global shortage of active pharmaceutical ingredients in our facilities. So overall expenditure, we're sitting at 21.3%, and the areas that were affecting that is still machinery and equipment and goods and services. So the last program, program 8, which is health facilities management. Here it will just be to report progress. So the program overall, they've got 5 capital projects that they need to do for the financial year. So in terms of progress, you will see that those projects are around those facilities. Ellis-Ross Hospital, so the project currently, at the end of the first quarter, it was sitting at 45% completion. FH Odendal, there were projects that were completed, but others were still ongoing. So the overall percentage completion was at 70%. Malamulele Hospitals, the projects that are being done there, we're actually sitting at 90% completion. But otherwise, the Tavaneng Clinic, the project was still in the design phase. Hybrid energy installation projects, they were also in the planning stage. This is just to show the actual projects that are being done in all those facilities, as well as the budget allocations. So you see that Ellis-Ross, it's around 60.5 million. FH Odendal is 44 million. Malamulele is 8.1 million. So in Malamulele, they are actually having projects in EMS as well as Allied. So the last remaining 2 there, that's where we said they are at the early stages. But otherwise, those are the budget allocations for the 2. So in terms of expenditure for the program, they were actually sitting at 51.7%. Yes, thank you, Chairperson.
Thank you very much. Well, this man always very brief with regard to the presentation. Honorable members, do we discuss this or you want? We have, all right. Yeah, I'm bitterly asking you to come back to the floor and present annual reports. Because it's by popular demand from members. But on serious note, what members have observed in the annual report, they may want to reconcile it with the first quarter. So I think it's odd that you do that. You are on the floor.
Thank you, Chairperson. So this is the annual report for 2024-2025. So we'll just briefly talk to the areas that we think the department performed very well, and also highlight the areas wherein we still have challenges. So in terms of achievements for the year, we managed to get unqualified audit opinion for AFS as well as performance to actually start with the CAT system in our EMS control station center, and also did procurement of equipment in various facilities in all areas. And as you are aware by now that we managed to complete the organizational structure as well as penciling of personnel. But otherwise, overall, the area that is still a challenge is around medical legal litigations, where we, at the end of the financial year, we were having 242 new cases, and the litigation bill was actually standing at 12.6 billion. However, there are measures that we have put in place to try to mitigate for that escalation. So in terms of overall expenditure for the financial year, the final appropriation was 24.7 billion. In terms of expenditure, we managed to spend 24.7 billion, and we only underspent by 22.8 million. So overall, we spent 99.9% of the overall allocated budget, and as I said, the unspent funds was only 22.8 million, and that was mainly as a result of slow recruitment processes. So in terms of overall performance of the department, we managed to achieve 63% of all the targets that we had in our annual performance plan. That actually meant that we managed to achieve 43 of all the targets. We didn't achieve 24. So that meant that we were at 63% overall. So I'll just quickly take you through the programs, areas wherein we had challenges. Program 1, percentage compliance to payment of suppliers within 30 days. That's why we didn't do well at 99.9%. As well as that was the only area where we didn't do well in program 1. We'll now go to program 2, wherein we didn't do well in terms of ensuring that all the patient safety incidences are reported within the required time frame. We were sitting at 91.6% when the target was 100. Even in terms of closure of those PSI, we didn't actually do well. At the end of the financial year, 289 of our clinics were ideal, but around PHC mental disorders treatment, we didn't do well. We still struggled in that area. Our district facilities, they did not manage to achieve the patient experience of care satisfaction rate. The overall achievement was 29%. In terms of ASK program, we still struggled to ensure that all our patients remain in care. You will see that in terms of our adult remaining in care, we were at 91.4%, and the target is 95. In terms of our child remaining in care, we were at 91.4 when the target is 95. We also struggled to ensure that all our patients on ART are virally suppressed. We didn't do well for adult as well as children. We were at 77.4 for adult, 57.2 for children. In terms of client loss to follow-up, we actually performed well. In terms of MDR loss to follow-up, we didn't do well at 8.3% when the target was 8%. In terms of TB pre-XDR loss to follow-up rate, we didn't do well at 11.1% when the target was 10. We also didn't do well in terms of antenatal first visit before 20 weeks rate. We were at 64.8 when the target was 68%. Another area where we didn't do well is mother postnatal visit within 6 days rate. We were at 95.5 when the target was 97%. But overall, in terms of maternal mortality, we performed well. We were at 104.8 per 100,000 live births when the target was 115 per 100,000 live births. Neonatal death in facility rate, we were at 13.4 per 1,000 live births. We were above the target. We didn't do well. Other areas where we didn't perform well is around malnutrition case fatality rate. We were at 10.7 when the target was 7.3. Deaths under 5 years against live birth, we were at 2% when the target was 1.5%. And as well as measles second dose coverage, we didn't do well at 81% when the target was 87. That was program 2. I will not go to expenditure as I did give the overall picture in the beginning. Program 3, here we continue to do well in terms of all the targets. Program 4, we did well in several indicators, except where we didn't do well in terms of diarrhea deaths under 5, pneumonia deaths under 5, as well as severe acute malnutrition death under 5, and death in facility under 5. So in these indicators, we didn't do well, and the majority of in most instances, it was patients coming to facilities late. Okay. So program 5, tertiary and central hospitals, we didn't do well in patient experience of care survey satisfaction rate. We were at 73 when the target was 82. Severity assessment code, we were at 97.5 when the target was 100. Patient safety incident case closure rate, we were at 89.8 when the target was 90. And the other area where we didn't do well is in acute malnutrition death under 5. We had 9 cases. We had 9 fatalities when the target was 5. So we didn't do well also there. So in terms of program 6, we managed to have an intake of 150 students. Program 7, we continue to do well in these 3 areas in terms of availability of medicine in all the levels. And program 8, we also did well. We had earmarked to do 20, but we ended up doing 43 projects. So this is just the breakdown in terms of all the projects that were done. In all areas, the clinics, district, regional, as well as tertiary facilities. So this is just a breakdown so that we can see where actually where the program was actually engaged in. So that's all, Chairperson.
Thank you very much, MEC. for the presentations. I will now take the liberty to invite honorable members to speak to the reports. Right from the report that was presented by the newly appointed HOD up to the last report, which is the annual performance plan. Labo, you'll be the first one. I'm bringing your mic, Chair. Labo, okay, Mdaka, you'll be the first. Honorable Mdaka. Yes, you will just indicate which one you are focusing at, just to make it easy for the MSNA team. Now I just want to note the hands first. Honorable Mudaka, you will be the first. Honorable Lobo, you will be the second. Honorable Mabucha, you will be the fourth. The third. And the most, you will be the fourth. And then I will be the fifth. And then you will be the last one, the sixth. In that order.
Thank you very much, Honorable Acting Chair, Honorable Deputy Chair of Chairs, and for giving me this opportunity once more, and greetings again. Yeah, and particularly that he gave me to be the first one to speak. I can't speak after Honorable Mabucha and Honorable Lwaho because they will ask all the questions, and I won't have any other question to ask. So that's highly appreciated to be recognized first. Look, let me first commend the department for one, appointing the HOD. We have been getting a lot of acting everywhere we go. Hopefully, maybe this appointment will also make sure that even in the hospitals there will be no more acting. I remember I went to Philadelphia Hospital. Everybody there was acting. I'm not sure about the groundsman. Maybe that's the only person who was not acting, but everybody there was acting. But also the groundsman was having problems because they are not few. The hospital is having a lot of challenges and in terms of cleanliness and so on, debushing and so on. So thank you very much for that, the department. And I also saw the report, even in the way they were reporting to us. That's why we wanted them to proceed, because we could see that really many of the issues are really positive. The first one, of course, was the unqualified, the targets that they have achieved, unqualified, audit outcome that they received. Well, I was going through the targets, particularly when they are put as percentages. They are very tricky because you are not sure, what is happening there. But I also saw another target that was quite low. I'm not sure, maybe I did not read it properly, or it was the figure that was, because target should always be above 50%. So yeah, target should be above 70%. So if you target anything that below 50, and you say, no, you have achieved, you have not achieved. Yeah, so, but I've seen that there is improvement in terms of the last time we met, including the child mortality rate, I believe, because then it's put as percentages, because last time it was put as figures and we complained a lot. So now I can believe that hopefully maybe indeed we are improving. We're also not getting a lot of challenges from our communities, because we're connected with the communities. It doesn't matter where. If there are challenges, they call us, because they know that we're serving in this committee, and we have to sometimes even phone the leadership during the night, including the premier, if there are serious challenges. So yeah, so I just wanted to comment on that. On the medical, I can see that there's a lot of issues. How many billions? That 12.6 billion. I think definitely we need to find a way of dealing with some of these questions. I'm not sure how much in terms of payments have we actually made, those that are settled. Maybe I need to check the billions that are now outstanding and the one that we have paid, if there is any, so that we know what is happening. We're aware that there's a challenge around the what do you call them? Attorney General's office. So hopefully we'll be able to find a solution towards that question. From my side, I don't have a lot of issues, except on areas of procurement where you said you've procured machinery, the ceiling X-rays and so on. That is not the picture that we got when we go to the hospitals. There are challenges, a lot of challenges. I can even mention in Philadelphia, I'm sure it is procured and is there, but it can't be installed because then there is no floor. There's no correct place to put it. Hopefully, if I remember very well. And we have gone to Lokong as well, hospital. There's also challenges with some of the machines there. I want to comment specifically on the machines that we procure. Whether it's kitchen issues or fridges or whatever you call them, you find that in many hospitals, these machines are not working. And we were showed a machine in Philadelphia which was delivered but never worked. I think it's in the laundry, if I remember very well. Yeah, big machine, because they are still doing a little bit of laundry on their own. But the machine has never worked. And when we go to many hospitals, machines are procured, but they never worked. Some are delivered in a particular area. Again, in Philadelphia, I don't know whether it is the generators, 2 of them that were delivered there, if I remember well. I don't know what is it, but 2 machines were delivered, maybe the generators or something, delivered there, but they cannot be used there for somewhere else. So there is a need for us to check on these issues of procurement. I think we need to strengthen that area because sometimes machines are procured, they are delivered, but they never worked. And they stayed there for a long time. I think that is the only area where I have a problem. And the HOD, I think I also had a discussion with you some other time when I visited another hospital recently. You know that hospital, I was born there. Things were very bad. Things were very bad. So I hope that the issue of Elim Hospital, I think Honorable Mabusha will also talk to it because he was talking about Wembe in particular, but now I'm being specific. At Elim, the mortuary there is very bad. I'm someone who is very, very disciplined. I can't enter into a mortuary, and I started trying to show that I'm not comfortable, because I'm with someone who's working there on a daily basis, who can even eat in that area, and now I can't handle myself. I had to look somewhere where I can actually do this, and then I had to apologize because I couldn't stand the situation. I normally try and behave, but there you couldn't. We were visiting someone there because there are almost only 3 maybe posts that are working, the rest are not working. And there are also bodies that have been there. I'm told they are just bones now because they've been there. They're supposed to be buried, purpose burials there. I think it's the same situation maybe in also what we found when we went to Villa Villa. So there's a need for us to really deal with that, because part of the issues that I had there was that if those bodies can be removed, maybe it can improve the situation. But also, procurement again, only 3 machines, only 3 pots are being delivered instead of replacement of the many that are not working. Thank you very much. So that's specific issues that I also wanted to raise, because it definitely affects our people out there. Thanks.
Thanks very much, Dr. Mudaga. Greetings again to the collective here. Honorable Chair, it's Heritage Month, and a lot of people are still in that mood of heritage. And we are over 30 years into democracy, and our healthcare system to date does not clearly integrate indigenous knowledge in terms of creating holistic healthcare. Therefore, we are calling upon the department to create a platform which will include and integrate those who practice with indigenous language. Mangaka borena le batho ba borena ba ile hore ba believer o metlhashana ye e creatileng ke tlhago ba modimo le badimo nke ba dumelelwe in a dignified manner to which will be regulated to assist the healthcare system which is flooded. Sometimes our doctors don't even know what is the cause of problems, and if so we'll appreciate if the leadership of the department can zoom into that space. Honorable Chair, as I go into the inputs, we are further asking for mobile clinics to be availed to the community of Juju Valley and all informal settlements in the province of Limpopo, and a clear timetable must be published for public so that the communities can know at what stage or period are the mobile clinics coming to their villages. I'm raising this premised on the fact that there are cases of malnutrition which are detected very late. There is a concern from the report which says that people detect pregnancy very late, which affects the whole fetus development cycle. And if people detect very late, because it affects the entire lifestyle of a mother-to-be. So if we have mobile clinics all over in communities and they work 24/7 where possible, people will be exposed to what needs to be done. What are the signs to check on if one is pregnant? And it will minimize future medical expenses and some of those which will fall in the category of medical legal bills. Honorable Chair, there is a specific incident which is worrisome of Chelezene Hospital, where over 1.6 billion of the medical legal claims emanates from. And we call upon the MEC and the HOD with their collective to zoom into that space and check what is the actual cause. Do you have proper people who are willing to do work there as professionals? Or what is a contributing factor of that institution being number one in terms of those bills? Or do you have a scheme which you are not aware of, which involves attorneys, courts, sheriffs, and so forth, that complex chain, which then leads to the department losing a lot of money? That space, please zoom into it thoroughly so that you can save the state billions. Especially also the other thing which you need to analyze is how many cases are from the sheriff, or how many cases you were not notified, and which court was central in terms of awarding such costs without your office being involved. Then you will know what you are dealing with. We will request, Honorable Chair, a report in terms of performance of the attorneys which are being assigned now to deal with medical legal bills claims, so that we check if they are indeed performing or they are just there to push time and claim from the department. What is the success rate and what is the failure rate? What are the issues which they have picked as legal people, which are common in all the claims? Please avail that report to the committee. And in the meeting before this one, we proposed that the department must explore the possibility of having liability insurance for medical professionals, because that will then remove the burden from the state in terms of paying some of these claims. Because some doctors or medical practitioners who are employed in our hospitals have private practices, but none of them in their private practices experience medical legal claims. But when they practice in our public hospitals, they contribute to that factor, so that can be ignored, Honorable Chairperson. I think the doctor here next to me raised the issue of conditions in our mortuaries, government mortuaries is very bad. If you go to the biggest hospital, Polokwane Hospital, you still write Petersburg. Actually, we must then get a progressive name. If Polokwane is not acceptable, I don't know why you still use Petersburg. The workers there are not happy, MEC. They are overstretched. The conditions, like in any of the mortuaries, are unbearable. You can imagine the claims in future, in-house claims from those people, from what they inhale every day. That is a health hazard and is worrisome if it's happening in your department. Chair, there is an issue which they raised here that they can achieve some of the targets because it's bus related. So that is a very important system. Tomorrow we'll be told that there were dual payments or people were not paid or the system collapsed. They are not elaborating what is the actual cause of the system failing them because they are blaming the system. What is that they've detected? Unfortunately, the CFO is not here, but the HOD can deal with that because it can't just be best failure and related to the input I made before this one. You must prioritize claiming your monies from RAF and medical aids. And you need, even if you were to get a dedicated panel, that must rotate to go claim monies from you, from these entities, and they be paid when they bring back the money, so that you don't spend additional money on legal personnel. Chair, there is an issue of TB for under 5 years, and they are just saying it's poor implementation of something there. And the same poor implementation of something recurs when they speak about MDR-TB. So we need clarity. What is that the department is going to do to make sure that there is total compliance in terms of this important indicator? If you targeted 150 to get 150 students and 200 applied, you actually granted 200, and their own reason or reason for variation or whatever, you say no reason. We need a reason why give motivation why you got to 200 from 150 to 200, because we'll sit here and clap hands and you'll find that you just got some people from your branches or villages to add the 50. 50 is a big number. And we will appreciate if the motivation can even reach 2,000, but we need a reason. It can't just be zero and no reason, but you have exceeded what you have planned for because it has, I believe, budget implications which must be attended to. Fortunately, the AG's office is here. They will tell us if I'm wrong, that if you exceed that target of 150, the budget is going to be affected and they will fight with you later on. MEC, in one of the meetings, there was an issue of Mpepu Airport. And I'm raising it here, Chair, because they said medical personnel is used by medical people. Majority of medical people are landing in that airport, which is not regulated. And I wanted to check if you are aware of those medical activities which are happening in that airport, which does not have a proper license. We checked. We are waiting for further reports. Because we don't want to sit with a problem or a scandal later where people are doing human harvesting of organs and all that in our province and you are not aware. I'm bringing it to your attention so that you zoom. When we said it must be closed until they get a license, the motivation was that it's a very important airport for medical people in Limpopo. So please zoom into that space. We have noted progress which is being made in terms of the issues that which were previously raised in the last meeting, Chair. Just the last issue, as we emphasize that there is a need to integrate indigenous knowledge so that we have holistic healthcare system in our province. I thank you.
Thank you very much, Chair. Greetings to you, Chair, and fellow colleagues, and greetings to the MEC and her team, as well as the AG. Chair, the indication that we are getting from the AG is that the department it's on a improvement phase in terms of their audit findings. So we want to encourage the department, more especially you MEC, that we want the department to move towards this improvement must get to where we want it to be, to clean audit. That's where we want the department to be. But there's a problem that was also identified, that it seems like a lot of attention is being channeled towards Capricorn, and then you are neglecting the rest of the region. More in particular, Vembe, in terms of your ideal status, which is a concern to us. And then the other issue that we have is that we have noted the skyrocketing bill of these medical legal claims, which colleagues have already alluded to. And we have seen measures that you seek to mitigate towards reducing this bill. However, MEC, we have been hearing one response meeting after meeting that we are working on it, We would like you, in as much as you are working towards harnessing your relations with state attorney and staff, we expect you to have internal capacity within the department, more especially your legal unit, to ensure that they are able to circumvent the deficiencies that they are receiving from the auditor, not the auditor, the state attorney. Because you can't come to us last year say, no, the problem is state attorney. You have identified a problem. So now, how are you dealing with them? No. What we expect to hear from you, MEC, the next time we meet, is that at least now, with the internal capacity that we have built within the department, we are now reducing these amounts and these claims. And then equally, your personnel need to be trained properly in terms of these claims. The other issue, second last issue, mine are not as pregnant as Levor's issues. The second last issue, MEC, is the issue of infrastructure. The infrastructure in the department is a mess. We don't want to sit here one day and hear that a certain building has collapsed on our people. We have been, this is one of the committee that is forever on the ground. So we have conducted an inspection in local. We have seen the nature and state of our infrastructure, and it's a serious call of concern. And what we also observed in those facilities is that there seems to be a challenge between the department and Department of Public Works. Because there are machines. We went to Philadelphia. I'll just give an example with the last hospital we visited. There's Philadelphia. There are big machines there, very big, expensive machines. But those machines, apparently, they've been laying there for the past 5 to 6 years. They are unattended to. No one can give a satisfactory response as to why these machines are not being plugged. But you'll be told, no, it's Public Works. Here, the department doesn't enter. But the machines are under our facilities. Next thing, those machines are going to disappear. And lots of money has been spent. Lastly, Chair, no, not lastly. We have noted that the digitization of record tender has come to an end on the 30th of June. But like we've been saying in our previous engagements with UMEC, that it shouldn't end here. We want a fully automated department whereby one can access a record. If I open a file in Seshego, and when I go to Hapani or when I go to a vendor, my file must be the same file that has been loaded in Polokwane, in Seshego, must also appear when I go to a department or a hospital or a clinic somewhere out of Seshego. So that's what we want the department, so that it can also assist you in terms of reducing these claims. Lastly, MEC, is that we want to congratulate you and your department for really coming to the party when your department was thrashed to say that it's not assisting its people. I'm referring to the case of Mr. Malepe. We can see you have restored his confidence, you have operated him, he's a proper person now. So we want to congratulate you, MEC, and would like to say it shouldn't end there. Keep on restoring the confidence of our people. And then congratulations, HOD. Thanks.
Thank you, and thank you, Chair, through you. Thank you for the presentation of the reports. I can also see the improvements, and I also just want to congratulate the MEC, the HOD, on the performance. That's on upward spiral. Thank you for that, for the unqualified audit. Hopefully next year it's a clean audit. I've just got two issues, MEC. The medical legal claims that is also spiraling out of control. 242 new cases added in the APP. If we look at the current standing, it's 12.6 billion. But if we break it down further, it's concerning that 8.2 billion of the 12.6 billion is related to cerebral palsy, which indicates that we need better control measures in the maternity services. I hope the MEC takes note of that your department can focus on those areas, things that it also makes the bulk of all the claims. Then also the other one that's concerning for us, MEC, is the high turnover rate that we have in the medical professionals, under medical professionals, and the high vacancy rate. Seems that there's not a conducive environment for the staff to perform their duties, and that obviously leads to the high turnover rate, especially on the professional side of the department. That is very concerning to us. I thank you, Chair.
Thank you very much, Chair. And thank you very much, Honorable MEC. I only have 3 questions. I didn't know you hired a cheerleader. I had some claps that side. 3 questions, Chair. The first relates to what the HOD reported, which is very encouraging if you talk about both the political and administrative willingness to attend to issues that relates to medical legal. It's a pandemic, that thing. You are fighting a very serious battle if you are not aware. And the unfortunate part is we do not have a legal framework that deals specifically with medical legal. I think each department, each province, just find ways of fighting medical legal claims. And your report in relation to improving your relationship with the state attorney, I think that is the starting point. And coupled with that is your intention also to appoint a panel of attorneys or legal practitioners, which will consistently and regularly interface with the state attorney, because I think that's where the problem is. But more than that, you would know that these medical legal claims emanate from a deliberate, in my view, effort by legal practitioners just to siphon, to milk the government, because they found a nest there. And because we do not have the legal framework to deal with those matters, it becomes very easy for them to continue to collapse the department. Lastly, I think the Auditor General commended the department in terms of having succeeded in dealing with material irregularity that I think emanated from a 2020 matter about the machine and all of that, which kept on creating problems for the department. And the AG reported here that you were able to successfully manage to deal with that. I know that Honorable Lobowo wants to sell Mpesu to the department, but I think it's a matter that the department can consider in terms of integrating indigenous medicine so that we can freely, without being judged, procure Mpesu and other related medicine.
Thank you very much, Chair. And I can't confess to say I've only got 3. I've got like 7 pages of questions here. And I know you're all smiling because that's par for the course. I'm thorough. I'm going to deal with the annual report firstly, and some of the AG's concerns, particularly around irregularities, material irregularities that were picked up in non-compliance with PFMA and MFMA. That's concerning. They're there for a reason. They are there to be complied with, and at this stage of our lives, we should not be dealing with those kind of irregularities. They are clear. They're absolutely abundantly clear in the PFMA exactly what needs to be done, how it needs to be done, who needs to do it, and what the situation is. So that's extremely concerning. And the other concern, of course, was the AG's report on projects, where projects are incompleted, contractors have been let go, dismissed, and all of those kind of issues. But on contracts, we are not monitoring and evaluation effectively on projects. Penalties are not being held. Deposits on, you'll know the words I'm doing, where they're not compliant or where they're not on time or where there's a backlog, there are penalties that must be incurred. There must be a holdback of funds until certain stages of any project is completed. And clearly that is not happening, and that is why we so often end up in this kind of situation on project delays. We're not getting securities. General safety around projects, particularly where we are building around infrastructure. The health and safety protocols are not even being followed. The AG visits sites to where someone has delivered 5 million rands worth of equipment or building materials or whatever it is. They visit that site and no one can find the stuff. No one can find it. There's nothing there to justify that delivery. I think it's a serious problem. I think it is one we're going to have to monitor very, very carefully. And security, and we've been the security route 1,001 times. We still talk about security. I'm glad to see, and it was something raised by the AG, that we need to do an annual maintenance plan. It's easy to do an annual maintenance plan, but it comes with a budget. Okay, if you're not budgeting for maintenance, you can't do an annual maintenance plan. Or you've got to do it round. So I've only got 2 million rands budget, so I can only do this maintenance, and this maintenance. Sometimes it feels like we go into municipalities where they've passed unfunded budgets. Now, and believe me, we see that a lot. You can't have an unfunded budget in a municipality, and you can't plan for things that you don't have money for in the Department of Health either. And sometimes, and this is where I get really concerned, because you haven't met your budget. 63%, your targets, 63% of your targets are met. But you spent 99% of your budget. Now, I don't know who's got it back to front or why, but you simply cannot. It's not acceptable to meet 63% of your targets, but use 99% of your budgets. They must be on a par, surely. And there's a big difference between 63% and 99% of your budgets. And we need to understand where that is coming from. With regards to the programs, and I'm going to deal also, and I'll come back to the AG's report because some of these appear in the first quarter budgets. Program 1, there's obviously a concern over asset verification. This is coming from your reports, not from mine. Program 2, there's obviously very raised concerns. Program 3, forgive me, MEC, I don't believe the data. I will believe EMS turnarounds in an urban area. I will not believe those figures in a rural area. And we have had this discussion, and we were all at the workshop a couple of weeks ago. That was held at the ranch. There is nowhere near enough ambulances or staff per shift to create that kind of turnaround of ambulances in rural areas. It's not possible. It is not possible. And what came out of that meeting too is that we're spending 5 million rand a year in costs on a college that doesn't even exist. Does not even exist, but we're spending 5 million rand a year there. I think that's very concerning. And MEC, in response to your written question that I wrote to you, on the EMS, on GPS, yes, the CAD systems were put into all of the vehicles. That I don't dispute for a second. But an extra 50 GPS units were purchased. And I think they were purchased, and in your response, it came from Kotsedi, at a cost of 26,000 rand per unit. Now, I went to investigate Kotsedi. Number one, it's not, no GPS units are in their catalogs. I couldn't find any. So I went to find the equivalent GPS systems. I can pick one up in game at 7,000 rand a month. 7,000 rand. 7,000 rand in total. Who authorizes expenditure on a 26,000 rand GPS system? And I went to investigate those systems that I can pick up for 7,000 rand in game. So let's just not go to EMS. Please, can you explain to me, because in all of your programs, you've got households. Households, this, and in one of the areas, in actual fact, 83.9% of your budget, and it's on program 5, has already been spent on households. What are households? Please define for me, in your programs 1 to 8, what are households? And what are we spending on those households? My house is a household. It's where me and my family live. That budget we need to be very clear about what we're spending on when we say households. If you want to spend money on households, you're welcome to come to mine. And then program 4, you're on 115.8% in the first quarter of your budget. 115.8% spent. So in the first quarter, you are way over your budget already. Your entire year's budget, not the quarter's budget. Accreditation and the nurses, health sciences and training, we were all part of that meeting. We know what the problem there. Program 8, now this one's really scary. You have an overspend. You're on 64.6% on goods and services. Program 8. And 0% on machinery. You're on an overspend in one, haven't in the other. We need an explanation. You talked about a recruitment plan. One of AG's concern is we seem to be suddenly having a very high turnover of staff. You know, a company that has very high turnover all of a sudden goes to find out what the problem is. Are people dead and dying, or overaged and overpensioned? Or is there a problem within the company that people will no longer work for that company? They've had enough and they've got out. And I suspect that's probably the problem, because we are so understaffed that our nurses and our doctors and our specialists are looking for somewhere else to go. Because when it comes to medical aid, medical legal claims, the fingers are pointed at them. So just quickly, quick questions. Digital. And the AG picked up some serious issues there. When documentation are picked up from hospitals and taken to digital for scanning, nobody can say how many pages, how many patient files, what the number of patients are that were dispensed from that hospital to digital. Now, digital charges us per page. I think it's about R1.02 per page. What if they say they've picked up 1 million pages from Mankweng Hospital? But Mankweng Hospital can't confirm that, and it wasn't 1 million pages, it was 600,000. There's no system in place to do the verification. They can tell us how many pages, but we can't tell them how many pages were sent to them. So we just pay, and that million. In some of those files, personnel documents, HR documents, suddenly appeared in a patient's file that had nothing to do with the patient whatsoever. We've just paid them R1 million a day to make a mess like that. And you can verify the data, but if you don't know who you're going to verify, somebody else's file, you can't clean up that data. Not without going through every single document. I think we've been had. I'm sorry, I think we've been had. Because we failed in putting the right processes in place in the first time. In Mpepo Airport, I raised it. We went on an oversight in Mpepo Airport on another matter when we checked the register. There were planes landing from Lanseria with specialists who were on their way, and not once a week, who were on their way to go and serve at Donald Fraser Hospital. That's what's in the register. Do we not, are there no specialists here? Are we not employing local specialists? Why are they flying from Lanseria to a place in Thohoyandou to go and work at Donald Fraser Hospital? Who is paying for it? Where are they coming from? And what exactly is it they're going to do? We need answers, please. I want to talk about, and a colleague of mine raised it earlier, the problem we had at Bela Bela, where paupers, and we presume they were paupers' bodies, were found out in the open. I'm not saying they weren't buried. I think they were just covered in shallow graves and not proper graves. I mean, we all know the media hype around that. Who was responsible? Now, just recently, well, no, last March, the contract was given to, I believe, is it Khode Funeral Services? Last March. But it's only implementing in August. So what was the delay and what was the problem? And I will ask written questions around the tender processes of that. But if they were responsible for that, because they were employed, under contract, March last year they were appointed, but only started in August this year. Somebody needs to be held accountable for that. It's not good at all. St. Rita's, I think, is a separate subject that's coming up. What I don't see in your budget is health was one of the departments that got money from the disaster fund. Health, education, public works. So there was a whole lot of money given to the province for the management of the disasters, the floods and stuff that we had particularly. Can you please tell me how much this department received and where exactly it was spent? Because I don't see that anywhere in any report. Where is it? What was it spent on? How much did we get? It doesn't appear there. And I'm glad we are going to do something about teenage pregnancies. Quick question, HOD, how many teenage pregnancies did we have in Limpopo last year? I'd like to know the answer to that. Because I think it's at one stage, just at Khapani, the numbers were absolutely out of sight. Ideal clinics, well, I think some of the clinics we saw were ideal yesterday, or last year, or the year before. I can assure you they're not ideal anymore. And so I could go on, Chair. Let me leave it there. If I think of anything else, I will come back and ask the second round. Thank you.
Thank you very much, Honourable Wilson. Thank you, honourable members, for you attempt to interact with the department, as giving your input, which the department will consider in the course of doing their work. And for sure, HOD, you know at the MEC that our interaction with you at the end of the year should assist you with regard to certain things. So we don't want you just to take this as a asking question and answering. We regard it as a process, management process, where those that you need to answer, you answer, but others, if they fall outside of your APP this year, will assist you in your strategy as you go. We take it that we are at one with regard to that. Well, I'm not going to do what I used to do at the end, but there are certain things I want to highlight to you using the Auditor General's report to want to propose improvement with regard to the current year, as you got the report from for the first quarter report. But there are certain things we needed to say them so that we remind you about them, because you are the custodian of the implementation of a number of recommendations made by the AG. And I must congratulate you for the unqualified report, you and your team MEC, for the good work that you have done, as well as your appointment of the new HOD. For sure, she told you that we're in a workshop where we just sharing ideas, getting information with different institutions. And myself and her were surprised that we didn't make application. Was it the EMS or something we didn't make? From time to every time as we interact here, the knowledge was that we have made application to the relevant structure to approve us. And that structure tell us, no, we don't have an application from Limpopo. As I was looking at her with sympathy, I said, no, it's good that the MEC is not here. Because there's something missing within the department. It's a matter of management pulling up their socks. And we know that in that, I don't know what you call that division, there was no leadership for a long time. It was just vacancy office and other things. We don't need to take it kind, but I think from management perspective, we want you to do the PLCO, the Green Management one, we talk about planning, controlling, and so on and so on. We expect you to gradually make sure things are changed. The first thing which I want to link to the current year is the employee compensation. I will call it funds, which you not use, but in the process, you would use it for other services, not the one that you initially was approved in a particular vote. For sure you use environment. Yes, and particularly of the employee compensation, we don't take it kind because of the difficulty we are having with regard to human resource. And that's very much important that you know that, because it is going to deal with your reputation and all of us' reputation, because in all our health facilities, there is shortage of staff. So that needed to be clarified. I wish clarification is that there's no true in that thing. We don't do that. I think that's very much important. Second one is about what Honorable Wilson have said about the percentage achievement of the overall, which comes to 63%. We want you to assist us in terms of reconciling that you have used the whole money, 99.9%, but there are some projects that the doctor there, when he was present, he said, this is not right, and it's good that you said so, because we must pass them. But these and these and these and these and these and these are not achieved. Put them there, 40-something% not achieved, or 30-something% not achieved, but the whole amount is used. And this is not a question. It's just an observation which require that we able to reconcile in future scientifically on how and why this thing is happening this way. Because from portfolio perspective, they see that as a smoke. And they are looking for a fire, where is it? And we needed your certainty with regard to that. Added to that is about your learning from it, your planning, your forward planning with regard to a number of projects that are sometimes delayed and so on whether you can do forward planning, that as the year begins, you begin to implement them, particularly those that are located in the infrastructure. I think that's very much important that we do so. We observe what you call patient experience of care. This indicator is, in the last meeting, I think we wanted the tools that you use. We observed that in the annual report is expected was 80 and what happened was 73. We are going to talk to interact with you so that we can be able to get added report to that, so that we understand the nitty-gritties within it, so that we are at one. So we'll talk to you with a number of, including the one that I'm going to, although you are going to respond, we'll make follow-up and be specific on matters that we want them to be clear, so that we use them as a unit of our oversight to you, so that we must not surprise you in that regard. I don't have to talk about the audit action plan. Is given that will happen. Well, I love the slogan of the AG, hashtag culture shift, strategic aspiration. I love that thing. I don't know what is your slogan, but I just love it. That we must shift. Oh, okay. I know the provincial council have a slogan, or the change. For sure, they are one. They are yeah, I think you heard what I'm saying, but I just love that slogan. And I'm reconciling that slogan with your slogan. Saudi Lodi change. When coming to are you still having Digital Veritas on site? Honorable Member just said it's ending in June. Oh, ended in June, and of course the Auditor General was also saying so that the contract is ending in June. Of course, they came before that time. And Honorable Wilson, there are difficult, of course, in any project, you will have some of the problem, but they needed to be sorted from time to time. So we want to know whether they're still there, and how are you going to deal with the problem that have arisen in the course of implementing that. For sure, you know the opinion of the committee. They think that we must thank them with the work that they've done. We may have to come back to you about human resources with regard to vacancy rates that are there. You have reported very well in the last meeting about the fact that although there is a huge vacancy, you only have a particular budget for few positions. We want a plan for those few, because our view is that because we have huge vacancy rate and a huge number of people active, the little we are given to employ, we must do it. We must have a plan and make sure that we do it within the financial year. I think we will have an opportunity to do that, or you can just do it. By the time we come to you, we find that everything is done. Yeah. How many cases you have resolved of the medico-legal? Resolve means, let me say how many you have paid, which means they are done in other language. Yeah? Yes, if you know them, you can also, we'll find a way not talking about them in this public platform, but you will be able to we'll hear what you say. But it's not advisable that all time we say them here. But because they are resolved, then you can say them. But the first thing is how many that you have resolved or paid currently. Just be patient with me. We've seen your key performance areas of the first quarter. There are those that are in line with the norm. There are those that are below. And there's one that is extremely very high, 51 point something percentage. You may have to share with us how come that is above the norm and what exactly were happening. There is an observation from the Auditor General about project delay, a number of projects not finishing on time. And we're not sure whether they are accompanied by the penalty in terms of your rules when people are not finishing earlier. You may have to share with us with regard to that. Just to save the department. They must inherit those risks from where we are. We are not operational, but we think that they must inherit those risks of you coming here. You say you're not finishing earlier, you're not completing. That's what is observed. But there are, which is not part of the annual report. But we found a number of projects on site that are not finished. The typical one was at that hospital there in the border. There is a project there that is not finished, and it's not now, it's not last year, it's before the MEC comes. And we are not saying respond to it. We are just saying we are dealing with a delay, but they are incomplete projects, which we don't want to ask you question why. We wish we can just say these are incomplete programs when we meet next time. And what is it that you are doing? because we don't want to ask you why this. Maybe you must have take that opportunity for now when we are still in good terms with you. Just to have all of them and say this was the problem, this is why they were left. And that will assist us to do our oversight work as we go. We also have a problem of those that are sitting in a hospital, like one honorable member said. There are machines, as we look at them, these are expensive machines, but they are sitting there, and we ask others, said, no, we never have manual, so we can see, we don't want to pressurize them to say what we don't want to hear, but they don't know why this machine is standing here, and it was never used. It has 2 years, 18 months, and so on, never used. And if you are not aware, our coordinator will share with you in a number of hospitals. The other one, they put it in one hospital. They say, no, it's not yours, don't use it. It's for that hospital. But it stayed there for a longer time. To an extent that Honorable Bowl said, no, you see now. By Kutishi, for sure, somewhere in their private thing. And we say this thing as an advice that let's assist each other so that we deal with the problem that are teething that the department have to deal with. We are happy that you have made commitment to the Auditor General about certain things that you needed to do. We will also, from time to time, check, because during the course of the year, the Auditor General is not with you, is left with us. We will use our proximity to you to make sure that by the time Auditor General come after 12 months, that we have done well. But this includes some irregular expenditure that nothing can be done because there is still process to deal with other matters. Do you believe in consequence management? And people who are doing this thing, I'm just asking it in general, you hold them responsible? Because there are a number of questions that we don't want to ask, but we think that this problem of consequence management that is not applied. We have seen that you have dealt with a problem at St. Rita's. Of course, we applaud you, but we are going to need your brief oral briefing today quickly, but we'll come back to you with the danger we have observed in that approach. Maybe I must reserve that for now. So that approach is dangerous, particularly in Limpopo, because there is a number of facilities that lack this, lack that. And the question and everything that we have reported there said we must do it there in that facility. That is dangerous to yourself and for all of us. We will learn from that one and see what suggestion we can make so that you deal with that from management perspective, because mainly it's about management issues that are raised there. And management science at all time have a way of dealing management problem. And the cut and paste or cut and chop is not one of them. Yeah, I think that's important that we say so. But for sure you'll say it in 2-3 minutes about what happened as you brief the post-polio committee. Well, I have talked about, we want to, and I've said it, maybe I did not say it the way that satisfies me. I got to change it. The matter we're talking about 63%. We want you to have a, I don't know what I will call it, to be concerned and after you've confessed and say, what intervention you're going to make to remedy that situation that is delaying you from dealing with certain matters. The last, is to appreciate in your report about how you are achieving with regard to emails, particularly in the response time. We don't want to differ with you now, but we want to work with you in the new year. I think we are going to zoom into one institution and ask you, when you say they responded in 30 minutes, what time did they get the message and when did they respond? Because there are a number of cases where the department come after 1 hour, 2 hours, and so on. By saying so, I think we must also have a tool that exactly verify. We don't doubt we don't have. We have a preposition and the information that people say, department did not do so. No. We tell them there must be a reason. But as far as we know, in rural area, they report after this time, and in urban area, they report after this time. And there is a problem of reconciling that. Sometimes it's not happening, and you don't report the one that you did not respond on time. You only report to us about the one that you responded on time. And that's important, that we get the whole report, and so that your personnel or your official can be able to properly deal with the matters that they needed to deal with. I'm just looking for one page that I was supposed to speak last, but I decided, let me just say everything. Did I talk about Leboa Kgomo? Okay. Of course, this one was triggered by the observation that the Auditor General have observed, but we also went there. We found that the facility, the station that was built there, there's no people. In fact, we were told that go to the parliamentary precinct. You will find, and we really found them there. But the question is on whether you're still going to use that, because from the official report of the AG, they observe whatever they observe, and that observation means that a station is existing and you are going to use it. But our report does not say so. It said you have abandoned it. And we tried to ask official, what's wrong? Well, we do not want to take the story about public works because we know we are interacting with you. You will brief us what happened, what's the problem there, to an extent that they decided to move out of that. Did you get what is called disaster allocation? If you got it, so you can just share with us how much you've got and what you are going to use it for as the portfolio. Because the members know which you, if it's true that about 3 or 4 departments got that, and they including us in that way. Yeah, I think I was speaking very slowly because I did not want to lose any other thing. And all that I've said, take away the fact that you got a clean audit and other things, but it must be defended. And defended from our perspective, there are certain things that must be clear as we go forward. Thank you very much. Honorable MEC, I think this is the opportunity to you and your team to speak to that And you heard me, I just said we will make your work easy by magnify certain things that if need be, that you clarify them further. Thank you.
Thanks, Chair. I think I will hand over to my team. I will come back after. Richard.
Thank you, Honorable Chair, members and MECs. I am going to take some of the issues raised and the teams will take their parts. Infrastructure, including disaster management fund, Mr. Ramawa will respond. Finance CFO will respond, issues related to finance, medical legal, corporate will respond, including the issues of digital issues. And maybe I can start with just to appreciate the time that we are given, also appreciate the comments and the advices that were coming out during this phase. And then I'm going to start with the issue of commitment to AGSA. Yes, we do have the commitment, and the CFO will expand to that. We hold monthly audit steering committee meetings to track the progress of implementation of the audit action plan. So that has been assisting us in the prior financial year, and we now are continuing in this year to ensure that we track the implementation so that we are not left with areas that are not attended. And then consequence management, yes, we do consequence management in all areas of our operations, including clinical areas, where we pick up that someone has not acted in accordance to the prescripts. Then we do act, we do disciplinary, starting from counseling up to dismissal. We continue to do that, although we are hoping that the dismissal is not the first preference, but if it's necessary, we do it irrespective of who the person is. We do dismissals. Even if it's a specialist, we do that if it warrants that. So I'll start HRI vacancy rate and recruitment plan. So that advert I was talking about earlier will be released today, I just confirmed. It addresses, we had a recruitment plan comprised of 2 areas. The first area was the funding that we set aside to address the issues that were raised, especially where we have people in acting positions, heads of clinics, heads of hospitals, heads of nursing. So those ones, we had some funding that was set aside, and we are advertising today. That's why I said even for EMS, all stations will be having EMS managers. For all our clinics, you will see there would be an advert for operational managers leading the hospitals. There will be CEOs, so that advert is addressing that. And then the second part in the advert is addressing the areas that has been raised, the issues of critical attritions. We are having people who have left the system. A majority of them are retirements, except in the medical side. The nursing side, its majority is retirement, and it's quite a number of those. Then those ones we will be advertising, we will be replacing people that we have lost thus far up to the end of August in this financial year. So all those attritions, they will be part of that advert. I think the issues of patient experience of care tools, we will share the tool, and then especially in the areas that will assist us to improve in that area. Teenage pregnancies in the last financial year, we 10 to 14 years, the total number was 315. And then we will request in terms of the Wombat, what has been raised in Wombat Hospital. We couldn't get exactly the main issue. So we will request that maybe as part of the resolution, then we could respond in writing. We couldn't get exactly what is the challenge there. Then the issue of Mpepu Airport. As a department, we are not aware of what's happening, but further clarification made me realize that it looks like there is an NGO by the name of Fly for Life. They have been supporting the province for years, and we didn't know how they travel. All we know is that we have a memorandum of understanding with them so that they come and assist us in areas where we have a need. Limpopo province does not have enough specialists. We have previously reported that we have advertised, we still do not get any. And one of the area where they are assisting us is in the area of eye operations. And we only have one ophthalmologist in the province. We have advertised, even in the previous adverts that we've just done now, that we are busy now issuing appointment letters. We didn't get a second ophthalmologist. This is an area where majority of the people who qualify, they prefer private. So we have several MOUs, including our rural health matter. We are supported by specialists from outside the province. The ones that we bring in ourselves, they normally travel through the normal airport. So we were not aware how that NGO was traveling. And we do not pay them any money when they come to our province. I'm trying to skip areas where the team will be responding on. We have noted the issue of target achievement versus expenditure. It has been a challenge for quite a while, but we have noted ourselves that we have been improving in terms of our targets achievement from previous year up to now. And we believe that as we continue to implement measures of improvement, then we will start to have that balance. One of the reasons why the budget will still be at 100% is because the personnel that are going out to perform certain activities, they are paid. So even if we haven't reached the target, they have been paid. We have purchased the consumables that they have used. But what we have done and what we discussed during our strategic planning was that if we are going out, we need to pick up what are the real challenges that we are not performing so that we can then explain why we are at 63 and have not reached the target, whereas we have spent the money. So this is an area that we are continuing to look at to ensure that eventually we get a balance in terms of the targets as well as the budget spent. Medical legal, one area I will speak of is it's in two formats or three formats. One format is adverse events that happen in facilities. The systems that we have put in place and we are continuing to monitor is that we prevent actually even occurrence of those adverse events, whether it's an adverse event or it's a communication that happened. Then the second area is now the legal and now preventing, fighting or defending us in court. And that is an area that members have talked about, and we will continue to strengthen that. We have strengthened the staff in the legal area at the moment. We have up to 10 units working now in that unit to ensure that we continue to strengthen this area. And the last area is an area wherein there is either collusion from staff and legal practitioners, that is the fraudulent part, and they all come into this, making this part of medical legal. As a department, even though the team is still going to talk about, we have made this priority number one. We have now gone to benchmark with other provinces. They have given us good advice that we are going to use, wherein we are going to get now all the managers of facility to make this their priority number one. We found that other provinces have what they call case managers. We have already identified the people who would be then assigned as case manager in each and every hospital to ensure that at that facility, when things are just starting, we are able to intervene and ensure that this doesn't happen. In addition, we are also setting up rehabilitation units within the province, wherein instead of paying the large sums of money, then especially for CP, which is one of our biggest challenges, other provinces have already won that battle. And not all, I think Eastern Cape has won that battle in that instead of them paying a huge lump sum of money, then they offer the services, because those monies that have been paid, it is known that most of the time it doesn't even go to the child, and the child end up coming back to our facilities. I think SIU just identified such a case for us where we've paid the money, but the child is no longer there. So those are the issues that we are now sitting on, so that we can come up, continue to improve the plan that we have in our midst. And then digitization and CHIS, I think Mr. Ravuluvulu will talk on that one. I can only report that we are just back from KZN. We have seen the system that they are using. We went there with CETA and also National Department of Communication and Technology, so that then we are able to accelerate in this area, and we are on track, and I think Mr. Ravuluvulu will give the final and the plans that are there. In terms of the nursing, there was a number, 150 on the target. So in the beginning of or when we were doing our APP for this financial year, we looked at the budget that we have. The budget that we have could only give us a number of 150 intake nurses. But early this year, as we were sitting, we have two types of students. We've got students who are in the community, new students who need to be trained as nurses. In addition, we also have nurses in our midst, those that we call assistant nurses. Those people are not able to do a more advanced work in the facilities, and they would like to continue training as part of their improvement. Last year, out of the 150 that we appointed, 75 were only for the new students coming from the community, and then 75 we had to do recognize of prior learning for the nurses that we had on our midst. So this year, early years, we realized that we can actually release 50 of our own nurses to go and upgrade themselves to become professional nurses. This is why the number went to 200. We only had a budget of 150, but because those nurses are already in our midst and they are already getting a salary, they are going to be released as study leave. That is why that number now is no longer 150. I think Mr. Ramawa will specifically also speak about Elim Hospital mortuary and other mortuaries. With that, I'll let CFO respond to the next set of questions.
Thank you, Honorable Chair, Honorable Members, Honorable MEC, and colleagues. My first issue will touch on the compliance to the PFMA. I would like to indicate that from the department point of view, we are doing everything within the capacity that we have in order to make sure that issues of compliance must not, be found wanting going forward. That is why when you look at our auditor's report, you will also realized that there is, significant improvement in terms of number of non-compliances. We only found ourselves with only 2 items that were left, which we believe that in the current financial year, because we have what we call the probity auditors in our space. Before a bid is awarded, is also subjected to the probity auditors to assist us in making sure that all those, minor issues that might have slipped through the fingers of those who are working in the space are identified and are addressed before the, contract or the bid is awarded, in order to make sure that as a province, we are 100% compliant. Then on the second issue that I picked up, I think this one will be that, just to add on what the HOD has already touched. It talks to the performance in terms of the achievement percentage of the targets, which is 63%. I would like to weigh in my response coming to the side of the budget that we have spent 99%. Allow me to give an example of Program 1, wherein you've got payment within 30 days, and wherein you'll find that as a department you have achieved 99%, which is less than 100%. Obviously, you have spent the 100% of the budget that was also allocated to do that particular, target. Definitely the work would have been done, people would have been paid their compensation of employee, and goods and services would have been spent. But that 1%, obviously, you'll find that, which is the shortfall, does not translate into the fixed cost, because the fixed cost I'm referring to this, compensation of employee, those people did not achieve 100%, the salary is gone. Calls that were made in order to make sure that service providers give us invoices in time were made. Goods and services budget has been spent. Same applies to the issues of revenue management. If the target is that you need to receive or collect 500 million, but you collect less than 500 million, those who are working in that space, I would have paid them. They would have traveled, they would have called and stuff like that. That is why when you look at the percentage achieved, the moment I don't achieve that which I said I will achieve, obviously the percentage will go down and the expenditure will remain high. So those are the things that I would like the portfolio committee and the department to try to reconcile in order to find each other to say what are the main causes, because fixed costs will remain there and they will always, take the expenditure high, and whereas the achievement in terms of the targets are low. There was a concern on program number 1, wherein it was around asset verification. I would like to indicate that indeed, when you look at the first quarter of the financial year, verification normally happens, in the third quarter, and we understand why it's a concern. We are going to start carrying out the verification now in the third quarter, and you'll start to see, the improvement in terms of the achievement going to the fourth quarter, whereby that verification results would have been, provided. There was also a question about what is a household? And I want to just, give an explanation. This is the nomenclature that is used in the management accounting, space. It's a decision that was taken by Treasury to say, when we deal with issues of paying what we call leave gratuities, when those who have existed the system, pensioners and anyone who left us, when you pay that particular, amount, treat it as what we call household under transfers. So meaning that the explanation is as simple as, it's a jargon that, if ever you need some of the definition, we can also provide in order for you to be able to interact with our report, in an easy way. So household is meant for leave gratuities. And it's, cut across the country and even, international standard, because they try to make sure that our reports can talk to everyone. There was a question that was raised about the contract which was awarded in March, and the implementation is starting to be, to show now in August. I didn't get the question clearly, and I would like, when we are done, maybe for that question to be given to us so that we can be able to respond. I didn't get it at all. It was also talking to the issue of supply chain, which I would like to also hear so that we can assist in that regard. There was an issue of employee compensation or compensation of employee, wherein the chairperson was very much concerned about budget which was meant for COE. But at the end of the day, it was fired and it was not for the COE, of which we take that concern. But I would like to indicate that normally what happens where you find that we end up moving money from compensation of employee to fund what we normally call the once-off project. It's when, for instance, there were staff who vacated the system unplanned because, of the flexibility of the system. You find that people, they are leaving, and for us to replace, it took a bit of time, 1 or 2 or 3 months, isn't it? So that particular period, definitely you realize what we call savings. And those savings, you need to declare them to our provincial treasury and also request, because the department, you'll find that in goods and services, they've got pressures like maintenance of equipment, they've got also maintenance of our infrastructure and stuff like that. Request that budget to be used for those, once off. Because in the ensuing financial year, the moment you fill that post, obviously going forward, you need 100% of the budget in order to honor the compensation of employee for those warm bodies that you have brought to the system. But however, in terms of other savings that are, as a result of, slow filling or post, those are the issues that we are dealing with together with Treasury and OTP. I think I've covered all issues that talks to finance. I would allow the next person to take over.
Okay, my name is Alfeli Rafulufulu, as I said when we started, and good afternoon once more, Honorable Chairperson and Honorable Members, Honorable MEC, our HOD and colleagues. I'm going to respond on about 3 questions, particularly regarding the digitization and also the system. The first question was asking about when are we going to be in a place wherein, irrespective of the hospital that you visit, the clinician should be able to access your record. Now, if I can just take members back, we started the process of looking for a system a couple of years ago, which, if I can summarize, ended up not materializing with the State Information Technology Agency. But that system was meant to centralize the current distributed databases into one, which simply means that as it is now, each hospital is having its own database. That's why when you visit our facilities now, you will be registered in this database. When you go to the next one, your record will not be seen from the other institution. So our solution that we have planned to implement is meant exactly to do that, meaning that in the province, a patient should then have only one record, and which is accessible by all facilities. However, as I said, that didn't work out. We are now in the process of still looking for the very same or similar system, but looking at what other provinces are utilizing, HOD touched on it. We started last month, actually it's this month early, with a visit to KwaZulu-Natal Department of Health, where they have developed their own system internally. And this system is having almost all the modules that are needed in a health information system. We proceeded to Gauteng, Department of Health as well, where they are also busy with the implementation of the health information system to replace the one that they were utilizing. All these systems that I've spoken about, they are intended to ensure paperless environment, meaning that the record that is going to be created from there going forward will not necessarily be on paper. Now, the other province that we were supposed to have gone to, but it was cancelled, was Eastern Cape, although they proposed that we rather go to Free State because they are implementing the very same system, which national, at some stage, National Department of Health also took us to Free State to look at the similar system. But now we want to zoom in into that system and be able to engage directly with the department that is currently rolling it out. So we referred to Free State. Unfortunately, the initial date didn't work out. We then agreed that will come now in this month. That is the system that is called HSM2, that also Free State, not Free State, Eastern Cape has developed internally. So we going back to Free State, as I said, this month, so that we can conclude these visits that we have started. When that is done, we are then going to take a decision internally of the system that we think we should go with, because the two are internally developed. The one in Gauteng is a system that they bought from the service provider. So once we have done that, we'll be able to then have the system that we can implement for Limpopo Department of Health with a central database that will address what the honorable member have just raised. Then I will move on to another question which talks to digitization still. I'm sure most of those questions are emanating more from the AGSA report. But honorable members, particularly those who were part of the previous committees, if they are here, you will remember the state in which these records that we're talking about were. In our facilities, old as they are, no disposal of the medical record had ever happened. Some of the hospitals like Elim was established or built around just before the 19th century, or in 1890 something, I think it was 96 or so. So if you can look at those records that have been created ever since then for all these hospitals to about 5 years ago, or even now, it's a lot of documents that were created. Now, because of the disposal that has not been happening ever since then, we ended up now with the volumes of records that has consumed a lot of storage space in our facilities. As I said, some of the members who happened to be part of the previous committees might have witnessed this. Some of those records were no longer filed in a proper way, meaning that we were not even complying with the guidelines that AGSA has even cited in their report. But for us to be able to comply with that, that is when we have then decided to have this project of digitalization, which we have started about 5 years ago, to assist us to make sure that we can be able to account for the records that we have. So it was not going to be possible. Okay, maybe the possible is not the right word, but for us to have counted the number of pages, by then, looking at the state of which the records were actually stored, it was basically going to need a separate project on its own, which we had to get another contract to only focus on that. I don't know how long that was going to take. Maybe we would have not even started with the actual digitization of the documents that we're now talking about. So hence, documents were collected the way that they were collected, in terms of them collected in the boxes. And if you can then look at the AGSA report in terms of the number of boxes by end of June, as compared to the number of pages that were scanned, you will then see that the average number of pages in the box, it's around 5,000 or somewhere there. The question will be, is that a reasonable number? Looking at the boxes that are being utilized, I'm sure people can be able to do the calculation to determine the reasonableness, but for me, it is reasonable that you'll have such amount of pages in the boxes versus the number of pages that have been scanned. Now, we then look at this contract when it was coming to an end in June. And by then, we had already started with the disposal process so that we don't take as many boxes as possible. But then we realized that even the disposal of the actual physical documents is going a bit slow because of the capacity issue, as well at the Department of Sports, which is responsible for the disposal of state records. And then there were some documents that were still, or records that were still at the warehouse for Veritas as well, that were not yet concluded. That, with the decision that has been taken that the department will be taking over or continuing with the scanning and archiving beyond this contract, then we concluded that we'll have to extend this contract by 12 months to be able to assist us with the work that is still remaining, so that we can scan as much as we can afford, while we are then getting this document to the warehouse that will end up deciding on. We then engaged leader, where they've taken us to the warehouse. The warehouse was massive and big enough to assist us with what we wanted to do. Unfortunately, leader is only leasing the warehouse. It requires us to install our own shelves. And at the end of the contract, we're expected to take out those shelves, which is going to be a problem to us. Now, last week in the Steercom for the same project, we have then taken a decision that we are going to use the building at Ladana, which currently was hosting or storing the finance documents. Because those are old, we are possibly going to get those out of that and through the disposal process. And we're going to combine scanning documents there going forward, and we are also going to establish the very same service at each facility, so that people can be able, or colleagues can be able to scan document at their own site going forward, until such period that the system is in place and all documents that are hard copies now are scanned. So I think I have covered the questions that I've noted under the digitization. If I can pass this to the next person. Yes. We have extended the contract not on the condition or under the condition of a certain amount per day or per month.
The last contract worked out at R1 million a day. Can we get access to that if it was R1 million a day? If you take the amount that you paid out and divide it by the amount of months and the amount of days, it was R1 million a day. Can we get access, please, to that information on the new contract? MEC can do it. We can, if we can get that in writing. Thank you. The terms of the new agreement. Thank you.
Chairperson, can I give clarity on that follow-up question?
All right.
When a contract is extended, it doesn't change, its terms and condition. However, I would like to indicate that the contract did not, even the initial one, didn't talk about how much will be spent. That is why the current contract has not yet spent anything for the current financial year, because it was meant for us to take over the project. So what the current service provider is doing is busy doing what we call the disposal of the hard copies that they had kept for us. Invoices that we are sitting with at this point in time since the beginning of the financial year to now, which is almost 6 months, they are at a region of around 16 million, which the department is busy now doing the verification. They've also visited the warehouse to satisfy themselves for the work done, in order to make sure that for whatever we are paying as we used to do, we need to satisfy ourselves that the work is done. 1/6. Yes. So I wanted to bring that to clarity, because if you look at from April to date, it does not translate to 1 million per day. Yeah. So what I'm saying is that this contract is informed by the budget available, by the amount of work to be done, not by 1 million per day. That is why it depends on what they've done and what the department has enjoyed and satisfied themselves.
Now do you fund it by normal budgeting?
Yes. Like now, in the current financial year, the budget that was provided was only 50 million because it was a winding off.
Yes. You're speaking on that thing, I know. You can see you and Wilson, you are penny. You are on the floor.
No, I just noted something, that the project is not yet finalized, and already there is disposal of documents. Can't you wait a bit on disposal until you are certain that everything is properly saved, so that we don't get surprised later that files have been disposed, and I suppose the disposal is in line with the National Archives Act and so forth of managing records. So disposing now, while the project is not yet complete and you have extended with whatever technicalities you have noted, might be suicidal. So kindly delay a bit, and you can start that process when you have seen that the system has captured everything. Noting that there was a concern earlier on that some files are even mixed with HR files, which you might need to check. That HR is far from those files, and they are saying during inspection they saw some HR files merged with the patient files. So please delay that to be on the safer side. In case the system collapses or it works, then you can start disposing. Thanks, Chair.
Yeah, thank you, Honorable Bo. We will find a way of making follow-up with the digital veritas. Yeah, that's why I'm telling him that we may have to find a way of focusing on it alone, so that we should understand certain things. But the reality is that nothing changed from the presentation.
And it's an opening the budget.
Yes, because say
Opening the budget. Was this 50 million that you talked about that was budgeted for? Is that for the 12 months? That's what I'm trying to understand.
Yes.
So that it's been extended for 12 months, but only to a ceiling of 50 million.
Yes.
In the 50 million in the first 6 months, the contract's finished, even though it's been extended for 12.
The reason behind the budget and the 50 million, you will look handing over, as well as the files that are still kept at Digital Veritas. Because when they still exist, you pay for the storage. Hence, when you look at the process of disposal, is to the advantage of the department, so that when you already have them on cloud, okay, you have to dispose the physical document because paying for those physical documents, whereas you have them in cloud because the objective was to have them on cloud. And the second part was that those documents, the state where they were kept by the hospital, you'll find that certain, information such as the leave and everything was pegged there. So obviously when they were picked up as they are because the service provider was not allowed to peruse the content because it's confidential. What they were expected to do was to scan them in order for us to have them electronical, in order to make sure that going forward, we didn't lose anything when we have disposed. We have disposed, but we still have them on cloud. Okay.
Well, yeah, I think we can pass, but we have observed what the Auditor General have also observed with regard to the difficulty with regard to file that cannot be accounted, including those that went to out of a particular facility. So it will mean that we may have to, for now, accept that, but come back to you with regard to satisfying ourselves. Because at the core of our attention was the ambiguous terms of reference, and they are extended. We thought we are important and our view can be taken into consideration when we say these terms of reference are problematic with regard to contract management. We understand that you close your eyes or you look away with that. That's why we say we will come back to you. We are worried that you are extending it on the same terms, and that same terms, the problem that we had with you. But anyway, you have extended those terms of problematic, the public funds. I don't think we must discuss it further than this, but we are disappointed about the terms of reference. And they tell us, we're left with 10% of the work that we did. That 10% will take 1 year. The other thing we worried was that it's only those guys who are working there. We don't see department official. No department official who can articulate what is happening there. For us was a problem because we'll continue in the file. Even if they are digital, there must be some champion within the department that are dealing with that they can account. And that was not far. Then we, as a department, we also frontally asked the agents, and they could not answer that part. And we decided not to follow up because we wanted them to do the work. Because they were doing their work honestly in line with what we had contracted with them. And we know the problem is not with them, it's us within the house. So as long as they will finish, but you should note why members were always asking about that. At the core was the terms of reference, which as you read them and you are aware of contract management, you immediately pick up that there's a problem with regard to value for money, because you may not account properly. You depend on them when they give you whatever they give you, and that's where our problem was. But at the warehouse, they put their things in order properly, and we hope the 1 year that we gave them will assist that they capacitate the department. also aware that this digitalization is not going to assist you in terms of health information system. So you still have the department, the whole, now I'm talking about the whole country, still have to assist us with regard to that. But the word was just that this is for filing, but the amount that it takes to the people of Limpopo is a lot. Is a lot of money. Yeah, the next person.
Thank you, Chair. My name is PJ Ramawa. Thank you, honorable members. I'm going to be responding to the issues that have been raised with regard to infrastructure. And I will want to address myself to the issues of the disaster management. Of course, we had a disaster management that has struck our province, I think it was around October last year. And the districts that had issues were only 4. We had a Capricorn where a roof of a clinic was blown out in Lepelen Kumbi. We had facilities in Mopani, the Van Velden District Hospital and clinics where trees fell on the fences, and it was not a major disaster for us in the sector of health. The only challenge was around Skukuni, where around Elias Mutwalidi, Matala Hospital had a very serious challenge of windows broken, carports falling, as a result of trees falling on the roofs of the carports. And the last one was Vembe, which was just a gate that fell. So when we see just the disaster management of the province, realize that the Department of Health was spared in the whole disaster that actually happened last year in October. And then being a Department of Health that needs to respond to the clients on a daily basis, what actually happened was that we did not wait for disaster management at national level to allocate the funds. What we did was that through COXA, repair and then you claim the money back. And the cost at the end was around 1.6 because, like I'm saying, we did not have a major disaster in the province. I know maybe honorable members might be saying that we had a very serious disaster at Bedford where there was an indication that even the hospital, people are not accessing the hospital. But after an assessment that was done by the province and national, it was found out to be a very serious disaster for the sector, unlike education and COPTAC with regard to the RTP houses. So we're able to repair there and there. And we have claimed the money that was spent for Matala Hospital because that's where the amount was high. I think it was around 1.4 million. We'll verify that information, check and submit that information. So with regard to disaster, that's what I can be able to say. But with the second one is the issue of the Philadelphia and St. Rita's critical care. These are the projects that were started in the during COVID period. And that's when the lockdown issues were addressed. The contract that was there then was coming to a new contract. And there were issues between the contractors and it was a litigation issue between the contractor and the Department of Health. This is not implemented by Public Works. And what actually happened is that with the issues that happened at George, when we wanted to submitted the designs to complete the work, there was an issue about compliance of fire from the gate to the other gate, which is a facility compliant. And the municipality was not giving those designs. But finally, through the intervention of the Office of the MEC, we were able to salvage the relations through getting the company to do assessment, which is in our database, so that we are ready for fire compliance. We'll be continuing with St. Rita's which by the end of the third quarter, Honorable Chair, will be able to make sure that that ICU in St. Rita's is working, and also Philadelphia, because the indication was that we need to deal with these projects and take them off the radar, because they were started and nothing has been finalized in that regard. And then with regard to the generators that are at Philadelphia, we have a backup on backup. We buy generators for districts as a way to say, as your generator fails to kick or there's a mechanical problem, you are able to get a generator from a district and use it. They are not for Philadelphia. Those two generators are meant for the district. In case there's a failure, you don't wait a very long time waiting for a contractor who might be getting us a generator from Gauteng or other provinces to come and connect the facility so that we do not have casualties. So the other generator that is there already has been allocated to St. Rita's, which when we after the visit by the minister and the follow-up, subsequent follow-up by the MEC, it was realized that we need to top up the generator that they have because it's not covering all the essential areas. So in that regard, those are some of the issues that I can indicate. But the issues on the structural issues at Philadelphia, there were issues that have been raised back and forth. They end up being resolved at the Office of the Premier through the DG and the MEC for Treasury and the MEC for, MEC for Health then, and also the HOD, where to give us a short history is that the contractor was instructed to do extra work by our implementing agent after the 15th of December, which is an anomaly. It's not allowed to happen that way. So hence, we decided as the department that this project needs to go back to Public Works to complete them. So it's a process that Public Works is dealing with it, but in that regard, there's a way we are finding each other with Public Works, because the laundry machines that are sitting there, we visited the site also, I think last month with the MEC and HOD. The laundry machines that are sitting there, we can't be waiting forever for Public Works to resolve these things with the client, which is their client, and we are a client for Public Works as a government institution. So those are some of the issues that they're being handled. And then the same with Chilizini. Chilizini, we have activated the tank, Honorable Chairperson, those laundries, the tank, the project for the tanks, because we needed extra water. Also, it was a project of Public Works where we realized that there was a need of an extra tanker to make sure that now we energize the laundry. So the project has been completed. We'll commission the tankers to make sure that the laundry works. And then the issue around Leboagomo EMS, I think we've also salvaged the situation. There was a situation wherein the contractor was not performing at all. And also the expenditure was sitting very low in that project. And as we return all these projects that had problems that were sitting at Public Works, it was one of the projects that had got issues. So I agree with the chairperson when he said we visited to find that the decision was taken to relocate our colleagues from that area to Parliament Precinct. But the latest portfolio committee that we've attended here, this issue was raised, and we went back, we're sitting with Public Works to see how do we make sure that because it's a property that is almost done. And then we'll see how we salvage the situation. But rest assured, honorable members, that project will be completed. It's either through Department of Health, through our POC, or and then through the PSPs that are still sitting with Public Works. So it's one area that even the AG has raised it, and then we have an action plan to deal with the issues that they have raised. And then the issue around EMS facilities. The portfolio committee visited the college at Polokwane, which is almost there's progress of the college. And then the other projects that we've done is the wash base, because the EMS needs to be certified, and they can't be certified without the wash base. So there are almost 9 to 10 facilities that now in the third quarter we'll be running with them to make sure they are the wash base done.
And then the EMS at Malamulele Hospital, which is also housing the Allied, it has been completed. So these are some of the projects that have been completed, but we understand there are pockets of gray areas in which will require an acceleration to make sure that they're completed. But most of the projects that were off the radar, come the end of the financial year, your ICU, your renal, all these projects will be fully functional. Thank you. We have a project that is running at Elim. And last time, I got a message from the CEO of the hospital to say the honorable was at the hospital. There's a concern that we're doing 3 trays. It's 6 by 3. All in all, the trays that are going to be done at Elim, there will be 18. 18. It's 6 tiers by 3. So it will be 18 trays. And we're also doing at CN Patudi. So there are facilities that were busy with the projects. At Nketsani now, we'll be busy with the forensic mortuary, because that's where we've got a problem where you've got bodies that are not identified, and even the family members don't even know, but they're not buried. So we'll be also doing the forensic at Nketsani. So all in all, we have got, I think it's 4 or 5 mortuaries that we're attending to. And we know for a fact, Honorable Mtak, there are facilities where it's unbearable for our people to be there. But where we have started doing revamp works and changing the trades like Mukopane and Yuabilabila, things have changed. So it's just that the pace, it might be slow, but equally also the resources. But if we can be able to deal with Elim, then we'll be able to address also other ones. The background with Elim is that, remember there was this issue that we're going to build a new hospital. We're going to build a new hospital. And later when you realize that that money that we are promised is not forthcoming, Chairperson, you remain with a problem. And we took a decision to say, we can't be sitting and say, we're going to build a new hospital, we're going to replace. You can't spend money to spend money. So, but we took a decision to say, as far as we're waiting now, let's make sure that the communities around Elim and our own clients get the best service in what we're doing. So hence, we took a decision to revamp all the mortuaries that have got challenges. So it's a program that we're rolling it up, and then we will add other facilities if we realize or we get fundings from somewhere. Thank you.
Thanks, Chairperson. And also, as they have answered, I just want to add that in terms of the challenges that have been raised, especially on issues that Honorable Mtaga was raising when you are doing your unannounced visits to our facilities, to say we acknowledge the issues of the acting in our facilities. Hence, our plan to say we fill up all the positions of governance in our institutions, because we know that where there is no permanently employed, whether CEO or the head of the institution, then we'll always be having problems when it comes to accountability. So we are busy doing that. Even when we check, when we are advertising our vacant positions, we ensure that we address that issue. Slowly but surely we are getting there. And also what we are doing is that even ourselves as the department, we do have our own unannounced visits like you are doing, and because of them, we are able to find out some of these challenges that are not being reported to us, and we are able to bring some changes here and there. For instance, what you were asking about, the issue your centritas. We are saying as the department, when the community is complaining and we go and we see that indeed there are challenges, we cannot just say, yes, there are challenges and we don't do anything about it. Hence, we try to bring some changes, change where we need to change to ensure that the issues are also being addressed. But also I want to stress the fact that as the department, I think you have seen, Honorable Chair and members, that we are actually a listening department, because we do take advices from you. If you can check most of the things that the HOD has said in the beginning, that we are responding to what we have been advised by the portfolio committee along with the plans that we are having. The issue of the health information systems, we know that we need it in our province. Hence, you see now we've started with the benchmarking in other provinces because we want to be well informed, and when we do it, we want to do it and ensure that it works for our province. So we are just saying, we appreciate the oversight that you are doing and also the advices that you are bringing, but also requesting that you acknowledge that indeed we are working very hard to address the challenges that we find to ensure that we improve the department. And we are an improving department and will continue to improve, Honorable Chair. Thank you. And lastly, the issue of the indigenous knowledge that we need. You know, I was actually sharing with the HOD and staff that I had an opportunity to attend a national event where our traditional medical practitioners were there celebrating Africa Medicine Day. And I even said I'm planning with my office to say now we need to create our own or revive the forum for our traditional health practitioners where we'll be working with them, because it's not only about acquiring or understanding their skills, but also to say there are indicators that we are unable to achieve, because when you check the reasons, it will be late presentation to our facilities, or a person wanted to consult first with our traditional practitioner as per our cultural beliefs. So we are saying when we work together with them, they will know when to refer a patient, even if a patient comes to them, but then they will refer to them. We're already planning to say we'd have a training for them, because that in the session that I've attended, that if we teach them now to be able to take vitals for the patients, then you'd know as a traditional practitioner that this patient who's here, I cannot touch them because maybe their BP is high. Then they would refer them to the clinic first before they can come back to them. So we are working on having that kind of a relationship which will assist us to work together with our traditional practitioners, and also respecting the cultural beliefs of our people. No, thanks, Honorable Chair. At St. Rita's, what I can say is that there was an unannounced visit by the minister. We only found out about the visit because it was unannounced in the morning when he was already on his way to come to St. Rita's, where he communicated with the office of the Premier that myself and the Premier join him as he'll be conducting his unannounced visit, because also in the portfolio committee of health nationally, they were asking him, why are you not conducting unannounced visits in the province? So our province was one of the first provinces where he came to do an unannounced visit, and he chose to go to St. Rita's. And the reason he gave was that he was getting lots of complaints at St. Rita's. We arrived there, and we did a walkabout around the facility to check, and also some engagement with the patients who were at the facility. But there were issues that were not good in the eyes of the minister, but even ourselves. The HOD was there as well with myself. Your issues, simple issues, your cleanliness, your housekeeping, you know, small things, our staff not wearing their uniform, you'd find a doctor like it's just a patient as well, and all those things. And then when we sat, after the walkabout, discussing the issues, you'd find that there are challenges in terms of the management not having their meetings where they are able to address the challenges. And we also learned that when we come, as the department saying we are doing our visits, if it's an unannounced with us, maybe we would make a mistake by notifying the district to say we are going there, can you come with us, because we want to be able to intervene with the challenges there and then. Then we'd think maybe there by the district there would be somebody who's notifying the facility, and you'd find when you arrive, people are complaining, but things are in order. So we found out that day that actually things were not in order. So now what we did is that because at St. Rita's, we did not have a a senior clinical manager. We had a person who was acting, actually they were changing almost every week because they didn't want that responsibility. Others would tell them that if we are in this acting as senior clinical managers, then we are unable to go and do our job, maybe in surgery and so forth. So we're changing. And the second one is that we had just brought in a nursing services manager who was actually in the district, but because of the changes that were happening in the organogram, the district she was brought in St. Rita, so she was not familiar with the environment. So the minister then offered to say, we can take the nursing manager to go to one of the facilities in Gauteng, maybe to go and learn, so that when she comes back, she can be able to assist the facility. And also, we look for a senior clinical manager who would assist the hospital, because St. Rita's is not a small hospital, it's a big hospital, it's a regional hospital, but when we checked even the activities that were happening there, they do not talk to other regional hospitals that we normally visit. So, and then lastly, we had an appointed CEO, which then felt like, because now there were these smaller issues, and obviously when things are not going right at the ground, the problem would then be on the leadership to say now, if we are saying we do not have meetings and people are doing as they please and we have a CEO, then how about we bring in new people to come and assist and bring in the change that we want to see in terms of assisting our communities. So what happened is that in the discussions, the CEO was then requested to say if you can be taken to the district, not being demoted, not same level and everything, but you go and assist because there are vacant positions in the district, to go there, so that we bring in a person that would be able to assist a acting CEO. And then that acting CEO was given 100 days to turn around the hospital, together with the acting clinical manager that was brought in, as well as the nursing manager, which we got as from St. Rita's. He was the assistant nursing manager, but whom was doing very well according to the advices from the district, that he was newly appointed. He had a few months in the facility, but already he was doing very well. So we left the 3 there to say they've got 100 days to turn around the hospital, and we'll go back there together with the minister again and the premier to see if indeed the hospital is turning around. But also, Honorable Chair, there are some challenges in St. Rita's that were there, as I've already touched on some of those that were met. Like we have a circular that has said that all hospitals will no longer give people files on their hands. When you go to a facility, you sit there, your file finds you wherever you are going, as part of trying to avoid the issue when it comes to medical legal cases. When they are going to sue us, the first thing they do is to ensure that the file goes missing in our facility. So we've seen that if we do that, then we'll be able to assist the process. But that was not also happening. And we've also noted that there are key positions that are not there. We're informed that you do not have a family physician, which are some of the things that we are working on, so that we can have them in that regional hospital for it to continue being a regional hospital. So since the minister's visit, we are always follow-upping on St. Rita's Hospital to ensure that things are going right. But in terms of the turnaround, we'll see when it's happening, but we will then be advertising the positions as well when the time is right, to ensure that the leadership in that facility is strong, and then we are able to work. Because another challenge was that what we expect is that every facility, the CEO and the team, they must do the rounds, the walkabout in the morning, every morning, to ensure that we see what is happening in the facility, but which is something that was not happening in St. Rita's. And if that is not happening, then that's where you'd find that we have many challenges that as management, you do not know anything about, but they are being talking about, whether you go to social media pages or calls in the office of the Premier and the office of the MEC and the office of the minister. Hence, based on those many calls that the minister was receiving, he felt it is important that he come and check what is happening, and that is what we found there. Thank you. They are all placed. No one is sitting at home. They are all placed. The nursing manager is in the province, and even even the CEO. So no one maybe was suspended or went to stay at home. Immediately there was a meeting. We gave HOD a task to work with the district executive manager that we find the suitable positions for them where they will be able to assist the department.
Good health, yes. Thank you.
Well, we did not discuss it, but we still going to discuss the report. The MEC has sent us a report. Yeah, I think it's time that we can conclude the meeting. Honorable members. I want to take some to honorable members, the MEC and the deputy from department or your team. I want to take the opportunity to express our sincere appreciation for the engagement we have. We have received an annual report. But we have discussed a number of issues. The main one being the infrastructure project. As well as the nature of the regular expense and the matters related to the we hope to not take a approach like the ideal clinic and hospital is the main issue. I can say that I'm not going to be, but the assurance that for interesting. And once again, thank you for your report. Thank you again, the Auditor General, for your report and guidelines. We got a number of issues that are homework. We will not deal with them in one meeting. Today we will be specific and deal with the first quarter and the annual report. And as I said earlier, we will still going to synthesize everything that we can see what are the matters that are important that we needed you to focus and just give us a snapshot of what we require, because maybe the question could not assist that you release the potential you have with regard to a particular specific program. We will do so, we've been doing so and we've been responding, and we want to thank you, everyone, for understanding that we are playing oversight, understanding that the nature of our work is deriving from what we are doing every day. And as we appreciate, I think that we meet like just